Hi, my name is Greta Perez, and here is my presentation on the aging nursing workforce. So by the end of the presentation, the learner will be able to do the following: explain how the aging nursing workforce influences nursing practice, understand and provide examples of how the aging nursing workforce impacts healthcare as well as society. So according to Newscap 2021, nursing workforce crisis looms with 4 million nurses retiring by 2030. 4 million. So that means 10.6 million new nurses are going to be needed. It is going to cost a lot of money to train these new nurses, and it's going to cause a strain on the existing nurses. They're going to be doing overtime. They're going to be expected to train these new nurses while maintaining their workload, and this will cause further burnout from COVID. They're already burned out, and it's going to make it worse. And this ultimately will affect patient safety. The nursing shortages affect patient outcomes. So some things that influence the nursing practice when it comes to the aging nursing workforce. According to Blockley 2018, the Nursing Council's most recent nursing workforce statistics determine that the nursing profession has an older age profile than most other professions, with 43% of the nurses aged 50 or more. That's a large percent. So what's going to happen is we're going to lose our experienced nurses. There's going to be a mass exodus of all the experienced, well-educated nurses from retirement. It's going to cause brain drain in the profession, and this will jeopardize patient safety by increasing the patient load for the remaining RNs. It's going to cause an impact on healthcare by causing a financial burden. To replace these nurses, we're going to need to hire travel nurses. They are more expensive, and the staff is going to have to work overtime. So that's costly for healthcare. And the cost of turnover, according to Reuter 2021, the cost of orienting a staff RN ranges from $65,000 to $75,000 for a med-surg nurse. That I was shocked about myself. So that's a lot of money to orient a new nurse. How it impacts society. So, of course, the patient outcomes are going to be affected poorly. Nursing shortages can affect patient outcomes. According to Reuter 2021, study results show that health organizations with low turnover rates had lower risk-adjusted patient mortality. So what's going to happen? So the nurses that are retiring are part of the baby boomer population. So the influx of baby boomer population as patients are going to take a toll. So we have the nurses leaving the bedside that are baby boomers. They're going to become patients with the existing patients. There's going to be an increase of admissions, a need for more hip replacements, knee replacements. It's going to cause a huge strain, and then ultimately impact the patients because there will not be enough nurses to take care of the patients. So this is how it impacts society. So in summary, we talked about the influence of the aging nursing workforce, how it is influencing the nursing practice itself by causing strain on the nurses, and how it impacts healthcare by increasing the cost, by training these new nurses, and how it impacts society, our community, our mothers, fathers, grandparents, how 75% of the new nurses are going to be taking care of us. And, they are equipped and they'll be educated, but they are going to lack the experience that the older population has of nurses. So we're going to be really missing out on that. That's very vital. So that's the end of my presentation. Here are my references, and I hope you enjoyed it and have a great day.